Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Audirie, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Arion Technologies Group. Welcome back to the RX to Riches podcast, where we explore the latest trends, innovations, and stories shaping the world of pharmacy and beyond. Today, I'm thrilled to welcome back a familiar guest to the Pharmacy View family of podcasts, Surge Singh, the visionary CEO of Locumate.ai. Over the last several years, Surge has been busy transforming the way pharmacists connect with locum opportunities in Australia. Since we last spoke to him, Surge has expanded Locumate's footprint in the United States, launching an exciting joint venture with the American Pharmacists Association called Health Shifts. We'll dive into Surge's journey, the growth of Locumate.ai, its expansion to other healthcare arenas, and what's next for this groundbreaking platform. So let's get started. All right, well, let us start, for listeners who aren't familiar with you or Locumate.ai, to tell us a little about your origin story, about how you started up Locumate, now Locumate.ai, and just to the point of you being in the Australian industry, and then we'll talk a little bit about your evolution to the US marketplace.
Sure. So Locumate started the night my co-founder / my wife came home after work, and she was fuming with an invoice in her hand. And I remember walking in, I'm like, uh-oh, what have I done now? And so we had a conversation, and she kind of showed me the invoice, the fees, and she's like, just blown my monthly budget. And I didn't even know the person coming in or how much I was going to spend. So I'm like, surely there's an app for this, right? And she's like, can you find me one? So that's how the whole conversation started. So that night, I kind of like, I'm like, oh, sure, I'll Google some apps and you can recommend it to your head office to use. And then when I started looking, and because of my background in HR tech, I'm like, I'm surprised that this space hasn't evolved as much as it should have, in my opinion. And the solutions that were out there, like, they do the first step or the second step, but not the system holistically. So that's where it kind of all started, that light bulb moment. And then we kind of said, okay, what would the ideal world look like? Me being the geek, I started, doing flowchart diagrams and the blueprint of it, what an app would look like from a flow perspective. And I said to Kavi, I'm like, how does this look? And she's like, that would be amazing. So I said, okay, if it works for you, we should check with a couple of other people. So we kind of invested in a clickable prototype to actually, because flowcharts are great, but that's not everyone's cup of tea. To make it look real, we created the clickable screens, and we kind of showed that to some users, potential users, should I say, and they said, the comment was, you're about to revolutionize the industry. And that was that moment we're like, oh, we might be onto something here, right? And as our first step, we kind of thought we'd license the software to agencies and head offices that could use it, but the appetite wasn't there because it was a very new concept within pharmacy, within Australia. So we're like, we're going to have to stand this up as a business and have not just the app, but the people that will interact on the app. And that's kind of that whole journey started initially.
So you've been on the podcast, or at least the Pharmacy View podcast, a few times.
Yeah.
How has Locumate evolved since that day? First of all, I got to say, you just flowcharting straight away as soon as your wife came in with this issue, very on brand for you. But I want to know, tell us more about the evolution of, so you prototyped it, you feel like you have something here. Tell us about the evolution of Locumate over the last sort of 18 months, especially since the last time you were on the podcast?
Sure, sure. So the last time I was on the podcast, we'd had gone to market. There was transactions happening, people taking shifts, people posting shifts, and Locumate as a business was growing, and we always wanted to be a software provider, right? So when we look at what we were doing from a technology perspective, and one of the things that I noticed very quickly was the bigger that we were growing, and well, I was like, the bigger we become part of the problem, right? We become one of the silos of talent. But if you look at the landscape holistically, and this doesn't just apply to pharmacy, but it applies to any kind of organization that engages external talent on demand, is you always look internal first. And then you go, who do I know? Or Michael, who do you know that can come in and work? Before you ever go external to a marketplace or an agency. So whilst Locumate as a business was doing well, I'm like, we're not fixing what we set out to fix, which was holistic solution for all of the steps. So the 18-month journey has been, how do we address that problem? And that kind of, I guess, the evolution of Locumate into Locumate.ai.
Well, I have to say, how do you address that problem?
Yeah.
So, tell us a little about that search for talent, because you're absolutely right. I remember as my days in a pharmacist, the first thing I would do if I had to try and fill a shift for a pharmacy assistant or a pharmacist, look internally, call up your mates. Hey, have you got somebody? So how do you harness that and make that into a repeatable process?
So for me, approaching that holistically, right? So to address the first question, how did we solve it? So I said, well, we have to take a step back as Locumate, the business that we are today, and look at it from a software perspective. How do we solve that problem? And simplistically, how do we give organizations, pharmacies, groups, access to talent at the click of a button? Right now, we were one of the steps in that process, and we needed to join the dots. So it was the evolution of Locumate from a marketplace to an orchestration engine that connects you to all the different pools of talent. So day one in pharmacy, it's how do I give you access to your internal pool? How do I give you access to your network? I mean, a lot of people refer to that as their black book of locums. Then go out to a marketplace or an agency. And we have to be comfortable with saying, we, as the original Locumate, don't care where you go as long as you have access to talent, because that is the problem we want to solve. And that's what we approached it with, is we go to a customer and say, we've built a solution that allows you to tap into any pool of talent that you need.
So there's talent and then there's talent.
Mm-hmm.
When I was a pharmacist and a pharmacy owner, I always thought of trying to get a locum as basically like a blind date.
Yeah.
You just don't know if this person is going to be a match, but it's too late. At that point, that person's already in your pharmacy, they're already serving customers, and that becomes an issue, right? If they're not the right fit for your pharmacy, for your business. How did you solve that problem? Or are you still trying to solve it?
I think that's a longer process, right? Step one is the pharmacy will be closed if we don't have anyone. So I need someone in there, right? But when we approach this solution from a Locumate perspective, we're like, but how do you know you're getting the right person? How do we know that people know how they're performing? So we collected feedback as that step one after every single shift. That data actually gave us insights into the gaps within the workforce that exist today, which allowed us to partner with companies like Audirie to go, hey, we've identified a problem. Is this something you can help solve or address? So the very first step that we took was actually with the Pharmaceutical Society of Australia and presented them with the data And they said, oh, yep, okay, this is the first time we've had data show us that there's a problem. Everyone knows that there was a problem, but the data showed it. How could we solve it? So Locumate by itself could not do that, right? We're in the business of getting people to job opportunities. So there's training partners that can deliver solutions like that. So the very first one, we partner with Audirie to introduce them to pharmaceutical side of Australia to address that at the grassroots level with interns, right? That's step one. Step two is, okay, now we have the data, we can see the gaps. How do we make sure that people train for the right skill sets? How do we identify those gaps? And then when an opportunity arises, matching the right people with the right opportunity with pharmacies that provide a particular service that's required and delivered by a particular resource. So that's the evolution of that, right? So you're right, it was just someone in blind date, but we're trying to take that element out and say, as the platform evolves, as we have more data, as the AI components get more data, learn, then we can not only match the right resource to the right opportunity, but the best resource to that opportunity.
And I think that's a wonderful exploration or illustration of how AI is really causing significant change in an industry or adding significant value, because we talk a lot about AI and how it is very ephemeral. It's very much in the clouds of how that's actually going to impact your day to day in the pharmacy doing your work. But this is an actual illustration of, hey, we can use AI to understand the strengths of a particular pharmacist, even from a student to an intern to a practicing pharmacist, build a profile of a pharmacist, and then start matching them to a pharmacy that can leverage their skill set, their particular skill set, in the right ways for the benefit of that pharmacy and that business. That to me, that sounds very powerful.
And like there's an evolution beyond that as well. So if you think of pharmacy, full scope of practice from a skill set perspective, but now pharmacies are trying to offer more services inside a pharmacy. So they need to tap into other resources within the allied health space as well, right? So that brings with it other challenges. And from a Locumate perspective, we're like, how do we solve that with the click of a button, right? And this is where that orchestration engine for talent doesn't limit us to tap into only pools of talent that exist within pharmacy today. That allows us to tap into pools of talent that exist outside of pharmacy as well.
Well, that's a good segue. So let's talk a little bit about those pools of talent outside of pharmacy, because Locumate.ai has actually ventured out into other sectors, physiotherapy, nursing. So tell me a little bit about what motivated this diversification into other healthcare sectors.
Sure. I mean, so we were in pharmacy. Bread and butter was pharmacy. My co-founder's a pharmacist. So we were thinking pharmacy and global pharmacy, right? But what we've built with Locumate, the technology can quite easily be transferable to other sectors where it's the same problem, right? I need someone, I look internally, then I look externally, and I go to an agency. And funnily enough, like we were approached by the people from the other sectors. We weren't actively doing sales or business development or marketing in those sectors at all. So for example, I'll use the physiotherapy and podiatry example with Hey Lucy, which will be launching in February next year. Haley from Hey Lucy approached us through our support channel, right? So it's like, hey, I'm in podiatry and physiotherapy. I want to have a chat. And I sort of said, okay, let's have a chat. We went through the meeting and she's like, we experienced the same problem and I was trying to solve it with technology. And she said, I looked globally and I couldn't find anything that quite fit what was in her brain at that time. And then she came across Locumate in her search. And then when she looked at our solution, she's like, you're ticking every box. So I don't want to recreate the wheel. How do I embrace the power of the technology that you've built into my sector? And I mean, sure, one day we could have gone down that path. So this kind of accelerated from a Locumate perspective how we do that.
Well, it sounds exciting. We'll have to bring you back after the launch next February. Tell us a little about how those professionals in those industries are receiving
Yeah. I
Locumate.ai
mean,
and services.
oh, definitely. And what that opens us the ability to do is when we talk about tapping into pools of talent, right? There's nothing stopping us from being able to tap into multiple marketplaces, right? Just because a marketplace exists in a different vertical doesn't mean we can't integrate into it. It just so happens that our technology is also powering that marketplace, makes it an easier place to integrate. But if we think about even nursing and allied health services that you can now deliver out of a pharmacy, you don't have to sign up to 10 different systems or 10 different agencies. Through the Locumate platform, we can give them a single pane of glass to tap into all those pools.
So I want to segue a little bit into Locumate.ai's expansion into the US and the formation of Health Shifts, which is a collaboration and a partnership with the American Pharmacists Association, or the APHA. Tell us a little bit about your journey, about how you got into the US market, which is not an easy thing to do for any Australian-based entrepreneur. So I know there are a lot of people listening probably that are very curious to know how you did that and how you ended up with this partnership that created Health Shifts.
Sure. So that journey began in October 2022. So the very first year that we were actually live in Australia as Locumate Marketplace. And I remember talking to my mentors and advisors at that time saying, I want to look at the US market because obviously Australia being the size as it is as a business, it's half the size of California, to put it into perspective. So if we were ever going to be a global business, you kind of have to be in the US. But we had zero pharmacy knowledge, no contacts, no networks in the US. So I said, we need to figure out how that industry works. And at that time, the feedback was, stick to Australia, right? Like, it's too hard to get into the US. I'm like, no, it'd be worth the trip just to find out how that industry works. And at that stage, we're part of an accelerator program. And then through that network, I got introduced to a pharmacist in California. After having a chat to that pharmacist, he said, well, we don't have a solution like this here. This would be phenomenal. So that gave me the confidence to go, okay, there is a gap in the market. One user, but at least a user is kind of validating that it would work. So I went to the NCPA conference, which is the National Community Pharmacy Association of America, the US conference. And I didn't know anyone. So it was kind of a wild trip. And it was in Kansas City of all places. So every time I talk to someone else, I'm going to Kansas City for a conference. I'm like, what are you doing? So I arrived in Kansas City, go to the conference, talking to people at the booth, and the feedback was amazing. People were like, yep, we need this. When can you launch? And that was the question. Like, I have no idea how to launch a company in the States, how to build a pool of resources. And I love my coffee. So I was in the coffee line. And in the coffee line, I kind of looked up and saw pumpkin spiced latte. As an Australian, we don't know what that is. So I kind of said, what in the world is a pumpkin spiced latte? And a lady in front of me turned around and kind of gave me a brief background on what pumpkin spiced latte is and what it means during the Halloween period. As it also happens, she is the CEO of the California Pharmacy Association. So sometimes the stars just align by taking the gamble and just being somewhere. And so she heard the accent. She's like, what in the world are you doing here in the US in Kansas City of all places? I explained what Locumate was, what Locumate is doing. And immediately she's like, we need that here. And that's how that relationship began. And that's kind of the first stepping stones of how we evolved from an Australian company being an Australian pharmacy to going to the US through that partnership with the California Pharmacy Association and through that network meeting Michael, who was the CEO of American Pharmacy Association, and really aligning because they saw what we were doing in Australia and they said how that can change the industry in in the US really engage the workforce, which is forever changing, right? If you look at the new generation of workers, no one wants to work in a single pharmacy 5 or 6 days a week. So our app at that stage they saw as the flexibility of it to give people options where to work in a market like the US. And obviously at that stage we were still a marketplace, but developing the internal pool, the network, the agency, so that just kind of added to the overall benefit to the ecosystem in the US.
So I assume it wasn't all smooth sailing from this meeting in the coffee line, just randomly for the CEO of the California Pharmacy Association to the formation of Health Shift. So tell me a little bit about the challenges you encountered as you were trying to stand up this new entity and you're expanding to the US market. How did you address those challenges to get to where you are today?
Yeah. So the two CEOs, visionary, but they report back into a board, right? Pharmacy itself is quite conservative, so there was a lot of meetings with both boards to get them on board in terms of what we're trying to deliver. Legal, privacy laws, workforce laws, like employment laws are completely different. In fact, California is one of the most stringent in the US. And that's where the place we chose to do the launch, right? So as an Australian company, building relationships to get a JV together, dealing with their lawyers, your lawyers, needing to be an American company, so that having your own US lawyers, then employment law, technology risks, like requiring all the security certifications up front now because it's a bigger market, security is front of mind, and then having so many stakeholders as part of that initial planning to get the JV up and running. Like if we go October 2022, paperworks were signed in June 2024. So it's not an overnight thing, it's a process, right? And a lot of people always think, oh, success comes overnight. Oh, you had one meeting, light bulb came on and away you went. It's like, no, that just started the flame in a sense. And then you have to work through the process to make sure that you can actually go from an idea stage to launch. And that takes time.
So what other advice would you give Australian startup founders who are trying to bring it to the US market? I think one piece of advice, which comes through crystal clear, is just show up, right? You went to a conference in Kansas City, which for listeners who don't know where Kansas City is, it's a place where, frankly, not many people would want to go. Kind of in the middle of the country, pretty cold. Sorry, anyone from Kansas City who's listening. But you went, and you went without knowing anybody, without really having a plan. You were just talking to people, and it ended up taking you on this journey. So 50% of it is showing up. What are other pieces of advice that you give Aussie startup founders who are trying to do what you're doing?
I mean, so my plan was to talk to people, right? That was the plan. You have to have an objective what you're trying to get out of that initial trip, because sometimes people just go blindly, go around and I went to a conference. What were you aiming to achieve out of that, right? So you still need a plan and what your goals are. I still had a list of people that I wanted to make sure the companies that I still interacted with to find out how the industry worked. But for Aussie startup founders that want to go overseas, number one, you still need a plan of what that would look like for you as a business, and then you need to validate. So my trip was to validate. After that trip, if people said that's never going to work, no, the idea is someone's already doing it or tried it, it didn't work, then that kind of sets your expectations as well. So it was an exploratory meeting visit for me, or for us, I should say, to find out whether Locumate could fit into the US market. If not, what do we need to do to get there? And I've had a lot of experience with Australian founders, and they're like, oh, I've got one customer in Australia. I'm just going to go to the US now, right? And that's also the wrong move, because what you need to make sure is that, I mean, what we had at Locumate was, I knew the business worked. The model was proven. And actually, that's the positive feedback that I got from the US. So when I presented to the board at CPHA and APHA, using customer case studies from Australia added so much value. Because they could relate. They're like, okay, yeah, we face a similar problem. We can see it working in a similar way or similar business outcomes. So being well prepared, because they will ask you questions, and I mean, to put it, if you fluff the lines, you kind of blow your shot, right? So sometimes you only get one opportunity. And for me, that one opportunity came in a coffee line. And if I wasn't well prepared, if I didn't have my, the elevator pitch and the explanation of how it actually works, but also how it could work for the US, then we wouldn't have a JV today. So showing up is one, but being well prepared and thought out as to what the objectives are of that trip and how you would present to someone if you did meet the right person, right? So even before I went to the US, I had a list of people that I would love to talk to. And funnily enough, the CEO of CPHA was one of those people. But I was trying to outreach directly to the association and all of that. So when Susan turned around, I'm looking at the name, I'm like, I know this name. Where is this name from, right? And when she said, I'm like, oh my goodness, so it aligned for me. Obviously, sometimes luck comes your way, but you have to be in the right place at the right time. So you create your own luck, but you also have to be really, really well prepared. And also, not everyone's going to say your product sounds brilliant. People will question it. And it got questioned so many times through that process. And that's where having use cases from Australia actually helped. So sometimes you can be a bit too quick and go, oh, we're just going to go straight to the US. Whereas Australia could have been giving you good groundwork to prove that the business works, test out different models, processes. So therefore, when you're in the US, you can say, actually, we know what will work and what won't work.
I think that's great advice too. You have to be in the right place at the right time. But when somebody turns around in the coffee line and asks you a question about what you do and why it's valuable, be prepared with a good, confident, clear answer. Otherwise, you miss your shot.
Exactly. I 100% agree with that. And sometimes, I meet other founders and like, oh, what do you do? And they can't explain it. And I mean, for us, like, with being in the industry, I can say, oh, actually, you need to tell me a bit more. And what about this? I can probe. Not a lot of people would probe, right? And then you've just missed your chance.
So looking ahead, what are your strategic priorities for Locumate.ai and for Health Shifts over the next few years? What do you see over the horizon in terms of opportunities that you want to grab and involve your platforms into?
Yeah. So first and foremost, deliver that holistic access to talent, right? So phase one was the marketplace. Then now we've got internal pools, networks, and agencies, which is already delivering a lot of value to our customers. The next question that came up was, we love the platform. On-demand workforce is great. But now there's a pool of resources sitting there. Can we engage them for full-time, part-time work? So the code launched this morning. So this is hot off the press. Pharmacy's first AI-enabled job board launched this morning in Australia, and it will also be launching in the US as well. And the same functionality will be available to other allied health partners that utilize our platform. So now we've got a holistic platform that can target different work types, should I say. And then we're building in the capability to attract additional role types other than just pharmacists. So holistically, dispense technicians, retail staff, students, all of that in the one platform as well. And then strategically working with groups to help their members get access to those the talent that they need wherever they may be. So pharmacy as a whole is something that we address the workforce shortage piece, on-demand workforce. And then the second piece is, how do we elevate the skill sets of the workers that are being engaged? So really honing in on that, the feedback mechanism, where are the skill gaps? So when, in the US or in Australia, there's a strategic initiative, for example, prescribing pharmacists, where do we have those skill sets? What skill sets do you need for the people to be able to do the full scope of practice? How do we develop those into people? Now, Locumate as a company by itself, we're not going to do the learning component. We're not a learning organization. But we will partner with, in the US, American Pharmacy Association, Californian Pharmacy Association, because they've got the training elements. But there might be a gap in how they deliver it, right, for the modern workforce. So partnering with AI companies such as Audirie to enhance that as well. So for us, it's about addressing the first problem, which is access to talent. Secondly, building that ecosystem so that workforce has more support in building those skill sets. But then the organizations or the customers that need access to those talents know that they're getting the right skill sets coming in, because holistically it's being addressed from a training perspective as well.
Well, I think it's really fascinating to kind of think about those particular aspects of your platform, what you're plugging in, how you are looking at it from a holistic approach. So let me ask you, let's fast forward 5 years. You're able to expand, integrate different modalities like training and learning. And obviously we just launched this was completely random. We didn't realize that we were going to be doing this on the day that you launched your brand new job board. So congratulations on that. But tell us, so I'm 5 years from now, I'm a new intern entering the pharmacy workforce in Australia or the US. How am I interacting with the Locumate.ai or the HealthShiz platform in your mind? Take me through it.
Wow, that's $1 million question, isn't it? Or $1 billion question. So from a user perspective, right? So we've got two sets of users: the workers and the organizations. Organizations that need the talent, and workers that are looking for flexible work. If I was a student going into a platform in 5 years' time, I should be able to identify where my future is as well, from a role perspective, work, right? So not every pharmacist is meant to be consulting pharmacist, clinic pharmacist. Are you more behind the scenes or talking to customers? Like, there's different skill sets that each person has. They're all pharmacists, but they all have, as a personality, different roles that would suit them, right? And so it's, how can we help that person figure out where they fit as a platform? And this is why I say that the ecosystem plays a key part of this, right? So if I use Australia, the PSA, and what they're doing with Audirie in the AI space, so imagine the two systems talking to each other in 5 years. A student has gone through training, the ability for AI to know what type of communicator they are, what skill sets do they have. And then go, as soon as you go in, we already know what type of opportunities would be best suited to you off the bat. So we try to take that guesswork out, because we now have enough data over the next 5 years to go, what recommendation engines would be perfect for this personality type, type, based on how they've come through the education system. And on the flip side, because you kind of need the organizations to make this make sense, right? An organization has a requirement. Right now, it goes out, people kind of say, oh, yep, that fits my criteria that I'm looking for, or which I think I should be looking for, right? And there's a match. They apply, they do a couple of interviews, done. Now we're saying we should be in a position in 5 years' time to say, as soon as company X has a requirement, the app should know which individual would be perfect for that opportunity. Now, sometimes that feels a bit scary, right? Or who's going to miss out on opportunities and so forth. But if the data is in the one spot, then it makes sense. And this is where the industry needs to head to, right? Like Australia doesn't even have a centralized credentialing platform. So we're further behind, but the US does, right? So with more data being a bit more central, it allows for things to be a bit more smarter because we can utilize all that data in the one spot. Now, once again, people will be like, oh, that sounds, having all that data, it's the ethical use of that data as well. So we should clarify, like, ethical AI needs to be applied to all scenarios. But going back to the student, as a student, and I wish I had this, even when I was at high school, I probably would not have studied the course I studied if I'd known what my personality was like, right? And that impacts, right? So that's why you have people dropping out of courses and things like that. But for me, as a pharmacy student who's got access to training at university through platforms like Audirie, feeds into the PSA's intern training, which then feeds into a workforce management system like Locumate.ai. That pathway then can open opportunities you didn't even know existed for you. Because right now you have a narrow view of what I could do. People still think, hospital pharmacist or community, or I leave pharmacy. Right? And that's why we have there's a 40% dropout after registration. There are so many more roles that exist and will exist into the future for the pharmacist of tomorrow. We need systems to work together effectively to open up those opportunities and open up the right opportunities for the right people, right? Because not everyone loves to talk to customers. It's just, it's a fact, people's personalities, right? And there are some people that don't like being behind the dispensary 24 hours a day either. They love talking to customers. And all these role types will exist. And they do exist today, and it's getting even more and more focused on the full scope of practice. So we need a system, and it's never ever going to be one system, right? Locumate AI is not going to solve the problem on its own. AI systems like Audirie won't solve the problems on its own. But the power of the data combined will completely revolutionize the workforce of tomorrow.
I do think that's a really powerful value proposition. Thinking back to my time as a pharmacy student and then as an intern or going into the industry, I didn't really know what I was good at. I didn't really know where I fit in, where my talents would be best used. I tried to get into hospital pharmacy. I'm so glad I didn't. I just feel that I wouldn't have been happy there, but that was for a lot of pharmacists, that seems to be like the ultimate, the prestige area of pharmacy to go into. But there's so many other different areas, and I think there's just not a lot of understanding of how are my talents best deployed.
It's predefined pathways, but the future is not predefined. Like your career could go in so many different ways. And imagine if data could help you with that, right? And then you need systems to make sense of that data. So that's where I see the future. I remember when I was at a company called Pager. And it was an applicant tracking systems. We used to work with partners that did like psychometric testing. And I came across a company called TestGrid that did like personality profiling. And that personality profiling would tell you what type of person you are and what type of careers would suit it. And I said, every high school needs this, right? Because your personality kind of dictates what you're going to enjoy and not enjoy. And if you can map it to careers, then even better. Now, obviously, we've come a long way since then as well. And there's so many other factors we can take into account to make recommendations and things like that. But it's the power of data. It always comes back to having those insights. But data is useless if only one set of population has access to it. So if only one university or one course utilized AI training, then there's not enough data to make more sense. So we need more adoption of technology that's designed to help the industry, because that's going to make it better for the industry. And I always take it back to, when we first launched the app, people were like, oh, it's an app, no one wants to use it. And I kind of talk through the scenarios it could help in the future. Some people bought into it, some people didn't. And some people say, oh, you could just go and Seek and find an opportunity. But I'm like, what is Seek doing for pharmacy? It's a generic job board, right? Whereas we've got a very big focus on not only filling a need, a shift, how we started, but then how do we make that more specific and deliver outcomes, use case based outcomes for the industry. And, to your point, Mike, you said AI can be used for deliver good things, right? A lot of people talk AI, but there's never a use case. You need a use case to get benefit out of AI. And the use case that we have is, how do we get the best person into your pharmacy for the right opportunity? How we do it is irrelevant, right? That's the outcome. It's irrelevant to the user, but it's important for us because we're like, okay, we need to join these data points together to actually deliver the best outcome for the customer as well. So yeah, I guess that's kind of what we're thinking from a future perspective.
I think you have a very unique perspective because you're somebody who has come from outside of the pharmacy industry, married to a pharmacist. So you had some understanding, right? Your wife would come home, tell you a little bit about what was happening in the pharmacy. I'm sure you'd listen and commiserate, but you didn't really understand until you launched Locumate and really got in. So from an outsider's perspective, I am giving you a magic wand, Surge. I am giving you the power to change something about the pharmacy industry. What would you change about the industry, specifically in Australia?
Where do I start? The first one is being open to change. Like, I always, like when I first entered, first and foremost, I said, being from HR Tech, I looked at pharmacy and I'm like, pharmacy is about 15 years behind in Australia for people technology, which is strange because people are your biggest assets in a pharmacy. And secondly, people were like, that's not how we do things. And that statement by itself is like, we're not open to change. And if I do a comparison to even the US pharmacy, right? And when I first went there versus when we launched here, and the kind of conversations we were having, it was more like, oh, this won't work for reason X, Y, Z, or we don't do things like this, or and so forth, right? Very like, not really open to change or innovation. There were some groups that were, but a large majority of conversations that I had that I'm now having 3 years later, right? So we could have had more adoption 3 years ago. Those customers are now coming on board, but 3 years ago, it was like, nah, we don't want to do it that way. We don't do it that way. And when I went to the US, it was like, oh my goodness, we need to change the way we do things like this. So for me, if I just summarize that, it's just be open to change. Because technology is evolving so rapidly at the moment, right? AI is evolving rapidly. You can't do all of it at the same time, but if you're not open to change, you're not going to do any of it. And that's how, groups, industries, companies get left behind. I've seen it improve in the last 12 months, if I'm being honest. But as a whole, we just need to be more open to, that could be a better way of doing things, or a different way of doing things that will give us better outcomes.
Well, Serge, I think we'll leave it there. Super excited to see how all of this will unfold for you, both here in Australia, or here in the US, I should say, and in Australia. So you'll have to come back, tell us more next year as you launch into new sectors and expand into new geographies. But just want to say thank you so much for coming on the podcast, telling us a little about both the history and the future of Locumate.ai and health shifts. Thank you so much.
Well, thank you so much, Mike, for having me on. Very interesting conversation, and I loved some of the questioning.
Well, my pleasure. That's what I'm here for. Thanks a lot.
Not a problem. Thank you.
Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Audirie. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy View podcast.